Hello, everyone. I'm Carol Fleck, and on behalf of the Attitude team, I'm pleased to welcome you to today's ADHD Experts presentation titled, How Seasonal Affective Disorder Uniquely Affects People with ADHD. Leading today's presentation is Dr. Sandra Kooij. Dr. Kooij is a psychiatrist and head of the Expertise Center, Adult ADHD, at PsyQ, located in the Netherlands. She is a professor of adult ADHD studies at the Free University Medical Center in Amsterdam, also called the VU. Dr. Kooij also is a researcher and author of peer-reviewed international papers and books. In today's webinar, we'll discuss a type of depression called seasonal affective disorder. You might also know it as the winter blues. Shorter daylight hours in the colder months of the year may contribute to a decrease in the brain chemical serotonin, which helps regulate mood. Seasonal affective disorder can cause sadness, sleep problems, and low energy. Seasonal affective disorder, or SAD for short, disproportionately affects people with ADHD. Our expert will help us to better understand this condition and its treatment options. We'd like to begin today's webinar with a poll question to our live audience. If you and your child have ADHD and seasonal affective disorder, do you both also have problems with sleep? What are those sleep problems specifically? Please select your answers and comment in the text box under the video player to tell us more. For answers to common webinar questions about slides, transcripts, and certificates of attendance, click on the FAQ tab of your webinar screen. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine. We just put the finishing touches on the spring issue, and it's one of our best. We reveal the results of a survey that 11,000 Attitude Magazine readers answered on everything about treatment, including the meds that work best, side effects, and the interventions like exercise and parent training that come highly recommended to manage ADHD symptoms. So sign up for Attitude Magazine for yourself or to share with a teacher or a loved one who could benefit from greater ADHD understanding. Click on the magazine tab on screen to learn more. Finally, the sponsor of this webinar is Play Attention. Research conducted at Tufts University School of Medicine demonstrates that play attention improves attention, behavior, executive function, and overall performance. Harnessing cutting-edge NASA-inspired technology, Play Attention offers a customized program for improving executive function and self-regulation. Through our digital trainer, you can control personalized cognitive exercising using your mind. Additionally, your program comes complete with a dedicated personal executive function coach who will tailor your plan as you progress. Both home and professional programs are available. Contact Play Attention at 828-676-2240 or click the link on screen to schedule your free one-on-one consultation. Visit www.playattention.com to learn more. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So without further ado, I'm so pleased to welcome Dr. Sandra Kooij. Thank you so much for joining us today and for leading this discussion.
Thank you very much for the kind invitation. I'm happy to be able to talk to you about late sleep, winter depression, and health, as all four are connected. And I'll try to talk you through it, because everything we experience in our body and in our mind is timed, and timing is everything for functioning. And if we don't live on time, that means in accordance with the 24-hour dark and light cycle, we are living out of phase, or we're jet lagged. We all know what jet lag is. But people with ADHD tend to sleep late as a rule. It happens in about 80% of both children and adults with ADHD. It's a result of one of our studies. And living out of phase and being jet lagged means that all these processes, the sleep, the high and low of body temperature over 24-hour cycle, blood pressure, melatonin secretion, bowel movements in the morning after breakfast, highest alertness in the morning, best coordination, reaction time, cardiovascular efficiency, blood pressure again, and onset of melatonin are all timed processes. Same is true for hormonal secretions. They are timed. And we can influence the timing of these processes by our bedtime. If our bedtime is late, out of phase, that means after midnight, we delay all these processes by our own behavior. But what I'm talking about is a genetic trait in people with ADHD. They tend to be late evening persons. So they are more active at night, have difficulty to fall asleep before midnight. They go to bed at 1 to 3 a.m. and they have a short sleep duration as a result. And this comes to several problems, because if you sleep chronically too late, you have a sleep debt. The sleep duration in people with ADHD, we studied it several times, is only 5 to 6 hours max. Because if you go to bed at 3 a.m. and you have to get up at 7 or 8, you do not make the required 7 to 8 hours at all on a chronic basis. When you have a short duration of sleep debt, you have the next day feelings of sleepiness, you have less focus, lower cognitive functioning, impaired memory, you may have an irritable or sad mood, and you start binge eating, because if you do not get energy by sleep, because sleep gives you energy, you start eating to get some energy. Your brain needs energy to function anyway. And when you see this small list of symptoms of sleep debt, you see and can easily tell that the symptoms of sleep debt and ADHD itself overlap. So this brought us to the question, is sleep debt in fact what we're looking at? Or is sleep debt increasing ADHD severity, to say the least? Well, if you look into the literature, sleep problems are quite common in ADHD. So the late evening type, or late chronotype, as it is called, occurs in 78% in our study. Insomnia looks a bit similar. It means you have difficulty falling asleep because you are too active, your mind keeps running and going, or you have difficulty maintaining sleep, 43% in ADHD people. Obstructive sleep apnea syndrome, a breathing disorder, 30%. Restless legs, periodic limb movement disorder, 30 to 40%. Narcolepsy is increased, enuresis, bruxism, nightmares. Every sleep disorder you can think of is more frequent in ADHD. And the question is, what does it learn us? What does it tell us? Is ADHD probably a sleep disorder? Why is it occurring in so many sleep domains that there is a problem with people with ADHD? And the symptoms, the acute symptoms of sleep debt do overlap. Well, I'll show you all these disorders because it's important to know which disorder is in your case, is the case in your story, because every disorder has their own proven effective treatment. So the delayed sleep phase has chronotherapy. I'll tell you about it. Insomnia, the ruminating hyperarousal, keep going brain needs CBTI, cognitive behavior therapy for insomnia. Restless legs requires something completely different, namely ferritin suppletion or pregabalin or other medications. And sleep apnea during sleep requires weight loss, mandibular device, or continuous positive airway pressure. So completely different treatments. And if you do chronotherapy for sleep apnea, it won't work, and vice versa. Yeah, the question is, you could imagine that ADHD causes the sleep problems because you're so busy and running around or overactive that you may be exhausted and you cannot fall asleep. It could be otherwise. Sleep problems may cause ADHD symptoms during daytime. Third option is that both influence each other. And there's even a fourth one, that ADHD and sleep problems share an underlying etiology. We think that number 3 and 4 are most probable the case. First, the circadian rhythm sleep-wake disorder or delayed sleep phase syndrome. That's the evening type people that we find so often in ADHD. It's called DSPS. It's characterized by a late or very late chronotype, and chronos is the Greek word for time, and that's why it's called chronotype. It consists of a chronic pattern of very late sleep and also very late rise, because if you go to bed at 3 a.m., you may want to rise at 11, and it's way too late for a normal daytime job. You may be sleepy during daytime and still have difficulty falling asleep in the evening. You may compensate for tiredness by an irregular sleep pattern. So you go early, you go very late, you go in between, and so on. It leads to impairment due to increased inattentiveness and or social problems. And it's important to know that this lateness is heritable. It's a genetic condition. It's associated with so-called clock genes, and they may last your whole life. So it starts in childhood and it is with you your whole life. There are several factors that set the rhythm besides the genetic effect that I just told you. What am I doing here? So you have the chronotype issue. The genes, they determine what kind of evening or early bird morning type you are, or in between. But also the time of light onset in the morning, so summer or winter, makes a difference, because as soon as the light turns on, your melatonin goes down and your dopamine is going up. Dopamine is your daytime hormone. And dopamine is not by accident the hormone or neurotransmitter that's dysregulated in ADHD. And we think it may be a bit too low. That's why the medication that we give for ADHD increases dopamine levels, and this improves often the symptoms. The time of darkness, on the other hand, induces melatonin onset, so that you may fall asleep 2 hours after melatonin onset. And dopamine, on the contrary, goes down. And all these effects of light and darkness are transferred to the brain, to the nucleus suprachiasmaticus in the brain. That's our biological clock, and it works through the eyes. So the light that you see in the morning needs to fall on the eyes, on the retina, to transmit it to the clock in the brain. So if you wear sunglasses all day, the light doesn't enter your brain telling you what time it is. So that's one thing to remember, because many people with ADHD do use sunglasses. I'll come to that. Here to the left, we see, oh wow, I'm moving myself. How do I get rid of that? Oh my God. Here I am again. Can you hear me? Carly?
I can
Carly,
hear.
I'm back.
We can hear you.
Okay, I'll go on. I was here about the factors that set the circadian rhythm. I still need to explain that circadian rhythm means circadia. Circadia is Latin for more or less 24 hours. And that's what the rhythm is all about. Do I need to put the slides on full screen or not? Yeah, I think so. Yeah, okay. Here's the eye, and here the light comes in, and it's translated here at the retina through the optic nerve to the clock. And here's a layer of so-called ganglion cells, and they can translate the light input, the intensity of light, to tell the clock what time it is. And light works for us very well on our energy level, our mood, and our sleep. We need a lot of light during daytime, and we need complete darkness at nighttime in order to be well synchronized and have a large contrast between day and night. So dark and light needs to be extreme, different, and not that we live inside buildings where there is no light and that we use light at night when it should be dark. But this is often the case, unfortunately. Another thing, I told you about the use of sunglasses in people with ADHD. We studied this using a survey, and we asked people with and without ADHD how often they used sunglasses and whether or not they were photophobic or oversensitive to light. Because my patients told me that they were oversensitive to light, and that was the reason that they invariably wore sunglasses even in winter or on cloudy days, and I was just surprised. And they said, I cannot stand the light. And it occurred indeed in 69% of our ADHD respondents, and only in 28% respondents without ADHD. And asking how many hours a day do you use the sunglasses? And it was significantly much more hours than the control group. That means that if you use a lot of sunglasses, your brain cannot synchronize with the daytime light during daytime. So as I already told you, the importance is the contrast between light and dark, between day and night. It helps you to get a more consolidated sleep rhythm. How come? I tell you about this study. It's by Martijn Arends, already 11 years ago. And he found out, comparing two studies, one about ADHD prevalence and one about light intensity in the United States. And he found the correlation between light intensity being highest in Mexico and the lowest prevalence of ADHD on the blue picture. And he explained this by saying that intense light during daytime, without too much of sunglasses, of course, enforces the rhythm better, consolidates the biological clock in people with ADHD, leading to better sleep and to lower ADHD symptoms, leading to a lower ADHD prevalence in these studies. He compared studies in children and adults, and in both in the United States and in Europe, and he found the same difference. So that's interesting. So that means that if you sleep better, synchronized with the rhythm of day and night, of light and darkness, and not live like a night owl, not live out of phase, but adjust your rhythm. I can tell you how you can do that. Your ADHD symptoms may diminish only by sleep treatment. That's the next subject that we're currently studying. Our first study is from 2010. We studied the onset of melatonin in saliva in 40 adults with ADHD, with and without sleep onset difficulties or insomnia. And we found that people with ADHD were much later with their onset of melatonin. So besides whatever behavior they might have in the evening, their melatonin onset was biologically delayed. And the delay was highly, highly significant. And the people with hyperactivity were even more delayed than those without. And the difference was 105 minutes later. That's biologically huge. And we did a second study after the DILMO, or the dim light melatonin onset, as it's called. It usually takes 2 hours to really fall asleep, but in ADHD it took 3 hours. So that explains why people with ADHD cannot sleep before 2 or 3 a.m. This is from the same study showing that also the movement patterns during 24 hours, this being the night, this being the day, was shifted to the right exactly 105 minutes, same as the melatonin onset was delayed. Also the movement pattern was delayed. We used for this study ActiWatches that measure every movement of your wrist, your non-dominant wrist, during 24 hours. Our conclusion was ADHD people are jet-lagged. They're out of sync. And the question is, are the ADHD symptoms, the diurnal and the late sleep, the nocturnal presentation of the same issue? Because we not only have late sleep, there's also a late appetite in people with ADHD. They tend to skip breakfast because they cannot stand food at that early time in the morning. They have a late temperature profile, same picture. We studied this as another study, and temperature and melatonin are closely connected. There's a late movement pattern I showed you and the late melatonin onset. And the question is, what else is delayed? I think cortisol, I think hormones, I think many other processes that are time regulated. Now, what you really came for is winter depression. I'm coming to that. But winter depression and late sleep are so closely connected. They're connected in 70% of people with ADHD. This is studies by Louis. He is a chronobiologist from the United States, and everything I know about it, I learned from him. And he said there is a circadian basis for winter depression. That means that winter depression comes in people who are late sleepers. And this is not by accident, the ADHD population. So what is winter depression? That's when you have 2 weeks or more a low mood starting in autumn or winter that resolves in spring or summer. So it's depending on the light intensity. And when the light goes down, the mood goes down. But it goes up again in summer or spring. There's often an increased appetite for especially carbohydrates. So think of pasta, think of chocolate, cookies, everything that you can find in order to improve your mood, but you grow fat. So your weight increases, and this is needed for sleep, and you have also increased need for sleep and low energy. Winter depression is associated with late sleep or late chronotype, with general depression and ADHD. And here's an important thing: the female-male ratio is highly different. Females are 4 times more often have winter depression or seasonal affective disorder. And the prevalence of winter depression depends on the latitude. So we have a 3% prevalence in my country, the Netherlands, but 10% in Norway, and depending on where you live in Norway. So the higher up north, the higher the prevalence of winter depression, because there is less amount of light in winter. But in my Dutch ADHD patients, we asked them 400 patients with a questionnaire about the seasonality of their mood swings. And they said 27% reported winter depression, and this is a 9-fold increase compared to the prevalence of the Netherlands. So yes, there is an increased rate of winter depression in ADHD, and other researchers have confirmed it. So it's also true for the United States. The higher the latitude up north, the higher the chance of having winter depression, because it depends on light and darkness. But the good news is winter depression can easily and quickly be treated with light therapy in 1 to 2 weeks. You have a better mood, better sleep, more energy, your appetite goes down, and you are able to control your weight better. If needed, you can use repeated episodes of light therapy during winter time until finally spring is coming. This is a picture of a Dutch newspaper saying that the Nobel Prize in 2017 went to geneticists of the biological clock. And this is extraordinary, because those geneticists found out that we have genes that code for our biological rhythm. So whether or not we are late or early birds. And this is important for health. And that's the new finding that made it worthwhile for a Nobel Prize in medicine, so not genetics. And I'll tell you why I think this is important. Because if you are a late sleeper, and we know now that 75 to 78% of people with ADHD are late sleepers, you have a short sleep duration because you have to get up for work or school. And this is also called a social jet lag. But having a short sleep duration increases appetite. And if you have a chronic short sleep duration, you will grow fat. You will get obesity. And when you get obesity, you are prone to diabetes type 2, cardiovascular disease, hypertension, cancer, and even Alzheimer's. And there are several factors that contribute to this outcome. But what we see in ADHD is late sleep, low mood, high food intake, and obesity is kind of a vicious circle that we can interrupt, that we can change, but you need to do where to start and how to do that. If we look at this picture, summarize. If you are obese with ADHD, you may have winter depression, seasonal affective disorder, leading to carbohydrate craving. If you are a late sleeper, 80% is, you have a short sleep duration, and your appetite hormones will change. It's known from the literature, leading to, again, carbohydrate craving. You will skip breakfast, which will lead later on the day to binge eating, also carbohydrate craving. So there are 3 moments in this overview leading to craving for carbohydrates that we need to interrupt, that we need to treat in order to stop this process of obesity. Because once you're obese, you get inflamed, your complete body gets inflamed, and those disorders are on the next corner. When we thought about this, we started asking patients, is it true that you have physical problems, physical diseases? It was not known at the time. Now we know much more, but we found indeed more problems in people with ADHD compared to controls. And it's also highly significant on all domains, even immune system, metabolic, skeletal, gastrointestinal, pulmonary problems. We had expected depression and cardiovascular and maybe metabolic, but it was every domain. This was scary. Later, Sam Kooij studied overweight and obesity in people with ADHD and found in a huge meta-analysis that the BMI is 70% higher in adults with ADHD and in children 40%. So we can't say it's not true. It's a huge meta-analysis. Latest research from 2021 showed that in ADHD, people have an increased risk for a huge number of physical conditions, 34 of 35 tested conditions. Really scary. And the strongest associations were for nervous system disorders, sleep disorders, epilepsy, and dementia, but also respiratory diseases like asthma, COPD. And those numbers were similar for men and women. So there's really something to worry about. And another paper recently made these pictures maybe easier to digest, that it's in the brain, it's the thyroid, it's the heart, it's the pancreas, the bladder, immunological system, and so on and so on, and allergies and migraine, asthma. It's a lot. So this is not to scare you off, but to show you the relationship between sleep, mood, and health. So now we get to the treatment, the best part, of course. If we want to reset the late sleep phase to an earlier phase of the night, preferably between 11 p.m. and 7 a.m., so synchronized with day and light and functioning of society, we use chronotherapy. So chronos is adjusting time. We do this with sleep hygiene measures, melatonin, and light therapy. Sleep hygiene refers to a bright day and a dark night. So what can you do? Limit your drinks after 8 p.m. to stop visiting toilets at night, because then you put on the light and it will wake you up. Block all light sources, your curtains, no Luxaflex. Use a good eye mask, no lights from chargers, timers, mobile phones that wake you up at night, no noises, and no screens after 9:30. Or if you need to study after the PC or watch TV in order to fall asleep, use orange goggles and put them on from 7 p.m. because these are timed processes. And if you do that, your own melatonin will advance, because orange goggles prevent blue light that wakes you up in white light to enter the brain. So your brain thinks it's dark, although you can use mobile instruments and blue light in the evening, but this orange goggles, they prevent the blue wavelengths to enter your brain. Second, use temperature. Take a hot shower, not in the morning, but at night. Why is that? Because if you are warm before you go to bed, your temperature drops, and this helps you to fall asleep. Same is true for a warm pajama, warm feet. If you have cold feet, you will wake up. We all know that. Try to wake up every day at the same time, also in the weekends. And I know people with ADHD want to sleep in the weekends because they're exhausted from the week. But if you do this on a regular basis with all the measurements I'll provide, you can do that because you're not so tired and you don't need the weekend to sleep in. Aim for a sleep duration of 7-8 hours between 11 and 7. No napping during daytime longer than 30 minutes, because then this will diminish the sleep pressure at night, so you will have more difficulty at night. Go outside in the morning, catch the light, walk the dog, advance the rhythm by light therapy in the winter if you need. Limit use of sunglasses during daytime. And we all know that people do this because they are oversensitive, but your eyes can get used to more light intensity if you train. Then the melatonin. Melatonin is highly effective for people with late sleep phase disorder. The dose is 1 to 3 milligrams at max, because this is already a very high dosage for your physiological level that you're in fact making by yourself. Take it at 10 p.m. in order to fall asleep at 11. Use a timer because you may forget the time. Don't use it after midnight because then it can reverse the clock. It's a timed medicine. It works only 3-4 hours, a short-acting melatonin. And if you use more, you may be sleepy during daytime. And you may not notice because you have always been sleeping during daytime. So I warn you. There are people that fall asleep with this low, relatively high dose of 1 to 3 milligrams, and they wake up at 3 a.m. Nevertheless, those people may need long-acting melatonin. We have this brand name in the Netherlands, Circadian 2 milligrams, and this helps a lot. It's licensed in our country for people above 55 because all older people have lower levels of melatonin and get more sleep problems. So back to winter depression. These are the numbers. Late sleep occurs in 80% of people with ADHD, winter depression in about 30%, and they come together and they are treated with the same light therapy. So if the sleep is delayed, your mood gets disturbed. So the timed morning light solves both problems of this biological clock problem. You can do it by yourself. That's even better news. The winter depression may start already in September and ends about April. And you can start light therapy after having 2 weeks of low mood, low energy, and increased appetite. Use it minimum of 5 to 20 consecutive days. Don't stop, don't interrupt, because then it is less effective. Use it typically 30 minutes, 10,000 lux light box, such as this one, at very close distance to your eyes, because the distance is very important for the intensity of the treatment. You need to do it every morning at the same time, before 10 a.m., but preferably between 7 and 8. In order to reset the clock to an earlier phase, it's important to do it at around this time. You may also consider buying light glasses. This is the newest way of providing light therapy, such as this one. You don't need to sit still for 30 minutes in the morning when the children have to go to school and you have to pack for work. You can wear 30 minutes during dressing or breakfast. We are using this now for around 5 years, these glasses, and I'll tell you more about it. When should you not use light therapy? Because light therapy is a serious antidepressant. You need to understand that it's not rubbish. It's really proven effective for winter depression, and it can induce hypomania in those people who are vulnerable for bipolar disorder. And this is not intended, of course. It is not what we want. If you are suicidal and depressed, go see a doctor first, because that's different cook, and you need to take it seriously. Epilepsy, narcolepsy, recent skin cancer, use of Mayo inhibitors, fever, first trimester pregnancy, retina problems are relative contraindications depending on whether or not you can have it according to your doctor. How do you evaluate the effects? After 7 to 10 days, and again any next week. The first improvement is fast. Already after 3 days, you may perceive that your mood gets more labile. So you start feeling more. You may be crying, but it's the beginning of improvement because depression is typically feeling nothing or too little. You may use 1 to 4 episodes in a season if it's effective. And what we also know is that increased appetite, increased weight, and increased sleep need, they predict especially the response to light therapy. You should start soon after the onset of symptoms, but light cannot prevent the emergence of winter depression, unfortunately. But people may know that going on winter sport or to a warm country where there's a lot of sunlight, like Mexico in winter, has the same effect as this kind of light therapy. Here are some devices, white light, and here's the blue light box. They have similar effects. It's important that it contains 10,000 lux. Here are the distances, the minutes, and the duration. Here is the light glasses. We use the ProPeak light glasses. There are many brands, and it costs 199 euros in the Netherlands, but we have a discount code of 30 euros, and this is the code ADC30. When you go to this website, you may find it if you like it. Many people ask, can I use the wake-up light? That is a light that goes up and gets stronger early in the morning, half an hour before waking up. No, it's not strong enough. It doesn't work as it should, and therefore we have those special light boxes. And you can have the light because the light is not containing UVA and B, so your eyes are not being damaged. That's important too. Okay. Chronotherapy is also associated with improving ADHD. That's interesting, isn't it? Because that's something else, something new. And this has been found in 2 pilot studies with bright light therapy, better ADHD. We found it with melatonin, a low dose of melatonin, even 0.5 milligrams only. This is our study, and ADHD severity decreased with 14%. And also other disorders in psychiatry improve by resetting the clock to relieve symptoms. In our study by Emma van Andel from our team, melatonin 0.5 milligram alone decreased ADHD severity and advanced the rhythm by 1.5 hours to 2 hours. So this is exactly the delayed the same number of hours as the rhythm is delayed in ADHD. Okay, I'm at the end already. I have a few additional resources. I will launch the ADHDpowerbank.com website soon, where educational videos for patients and professionals are available on ADHD comorbidity assessment and treatment. divacenter.eu is the website of the diagnostic interview for ADHD that we developed and is available in 30 languages. We also have the Young Diva 5 for children and adolescents and the Diva 5 ID for intellectual disability. The H3 network is a recently founded head-heart hormones network with webinars on the connection between ADHD in women and hormonal mood changes across the lifespan, as well as the female heart in ADHD women in perimenopause. I'll tell Carly more about it. I'll send her more resources about it. So this is the ADHD Power Bank webpage. This is Dora Winshank, my colleague, and this is me. And we want you to charge your batteries with knowledge, because knowledge is power. And if you know how things work, you can negotiate with your healthcare provider, and your healthcare provider can have the same knowledge as you. We think that's important. So we are at the Q&A, I think. Carly.
Hi. Yes, thank you, Dr. Kooij, for that presentation. Before we start the Q&A, I'd like to thank Play Attention once more for sponsoring this webinar. I'd also like to share the final results from today's poll question. We asked, do you or your child experience sleep problems, and what are they? 21% said they had difficulty falling asleep. 16% each said trouble waking up on time and getting too little sleep. 15% said waking up in the middle of the night, and 13% said hyperarousal at night. Now to your questions. How does SAD relate to screen addiction? Is it a way to cope with feelings of depression, overwhelm, or understimulation?
I think that people who are late sleepers and winter depressed may turn to games and to internet and screen addiction. And screens obviously emit light, blue light, and it's close to the eyes, so it has similar effects if you sit for a long time behind the screen as light therapy, but it's at the wrong time if it's at night. So in this way, screens can induce even further delayed circadian rhythms, so even later sleep onset time. So you are already late if you are an ADHD person. But using screens after 9:30 even delays your rhythm more. So it cannot be recommended to do it at night. It is maybe a good idea to use it early in the morning in winter, but maybe then you have other stuff to do. Depression and feeling overwhelmed are connected. Of course, you have a lack of energy and everything you need to do is too much, and you cannot have no overview over tasks and obligations. You're so tired. Yes, there's a relationship between those phenomena.
Is the effect of seasonal affective disorder worse for teens?
It could be. Teens have, per definition, a late sleep phase. Also, teens without ADHD. This is typical for all adolescents that they are later sleepers than all children and all adults. And this rhythm advances back after you reach the age of 25 to 30, but it does not happen in people with ADHD. They remain late forever. So teens in general have difficulty going to bed on time, and they have difficulty to getting up on time in the morning. So you could argue that light therapy is good for all teens, and maybe melatonin also, in order to fall asleep earlier and get up earlier. Is both treatments.
Someone asked, does SAD affect women differently than men? And if so, how? And do older adults suffer more than younger people?
Yeah, I already showed you the numbers that females are 4 times more often suffering from SAD compared to men. I think this has to do with the connection between the menstrual cycle, the moon cycle, and the seasonal cycle. These are all time-related cycles. We have the day-night cycle, which is 24 hours. We have the menstrual cycle, which lasts a month, more or less. We have the seasonal cycles of the seasons. It lasts 3 months, and there may be more. But I think all cycles must be connected. And as women have more cycles than men, maybe they're more vulnerable also for this SAD cycle.
Is vitamin D recommended for persons with seasonal affective disorder?
No, vitamin D is good if your vitamin D is too low, and that's something your doctor can measure. And I have to say that vitamin D is generally low in ADHD, and we don't know why. So it's always good to take vitamin D in winter, I think, for everybody, because you get vitamin D out of sunlight, which is not available usually in winter. And if it's available, we use a lot of skin protection, factor 50, preventing vitamin D to be developed in the skin. The other way we can get vitamin D is by eating fatty fish. And most people don't do that sufficiently. So most adults and children in our Western society living indoors in winter have low vitamin D levels. So do take it. It can induce depression, but it's not typically something that you use to treat winter depression. That's light therapy.
Someone asks, is there any harm in taking melatonin supplements every night before bedtime?
Well, not everybody may agree with me, but I think melatonin is highly effective and necessary for those who are late sleepers by genetic makeup. So if you do it only now and then, it's not working. You won't get an earlier rhythm. What's the aim? That's the aim of melatonin therapy. It's not a sleeping aid as so much, but it's especially a clock agent. It works to advance your sleep rhythm. And this is not something you do on now and then. It's needed on a daily basis. But then you need low doses. You need a structured intake at a fixed time every day. I would say do it every winter, the whole season, and check whether or not you still need it in spring and summer, because light is early on in the morning in summer, and this helps you also to get an earlier onset of melatonin production.
Okay, a teacher asks, in Wisconsin, we have long, dark winters. What signs should I be on the lookout for with my students who have ADHD?
Well, if they are late at school, and if they arrive at school, they are only sleeping on their desk, then you definitely know that you're dealing with a late person that's not awake yet. And you may advise light therapy and potentially also the use of melatonin 1 milligram at 10 a.m. You can buy it over the counter. The light therapy you can order yourself. It's easy, it's safe. You could also consider using daylight lamps at school in order to wake them up from the onset of school in the morning. But it's expensive, but there are schools are doing that in order to wake up teens in general, in order to improve the teaching level and the memory of the memory quality of the teens.
Someone asked, to what extent are psychiatrists aware of SAD and its relationship with ADHD?
I'm afraid not everybody is aware. So that's why knowledge is power. And this is why I try to empower everyone with knowledge so that you can check the literature and ask your GP or whoever is your healthcare provider about SAD, light therapy, late sleep. Also, late sleep is not very familiar yet. It's relatively new that we studied it in 2010. And since then, it's not easily that the scientific community takes over, because if you're the initiator and the only one, it's not really, people don't believe it so easily. So it needs to come from several sources in order to get more accepted, more used. I'm afraid it is how science works. It takes a long time.
For people who use melatonin to try and help them go to sleep, is there any effect on their, and if they take stimulants during the day, is the melatonin, does that have any effect on the stimulant dosage during the day?
Well, not that I'm aware of. I think people who are late sleepers and have ADHD and use both melatonin on time and stimulants on time in the morning, they're the best balanced patients I know. So I consider ADHD as a day and night problem because of the late sleep pattern and the exhaustion during daytime, leading to more hyperactivity, to more restlessness, to more impulsivity. So I think treating both at the right time, so dopamine agonists in the morning, stimulants, and melatonin at night, and not vice versa, does help to get a more consolidated rhythm and more stabilization.
Okay. Someone writes, SAD has sapped my joy and my energy. How can I get it back? Is light therapy likely to do that? And
Sure.
Are there any other approaches for this?
Well, it's good to sleep well, eat well, move a lot, but we know all that. And it's very hard when you're depressed in winter to get out of the chair and to really get moving. But taking a dog and walking the dog outside may help to get at least more rhythm. That might also be a way to do it. But in winter, there is no light, so just buy the light in a light box or glasses, or book a holiday to a sunny spot, to a sunny place, if you can afford it. It works if you don't use the sunglasses all the time.
Mm-hmm. About sunglasses, someone writes, my teen and I are very sensitive to light. So using full spectrum light for 20 minutes each morning during the winter is really difficult and causes headaches. What can we do?
Yeah, well, full spectrum light is, the light boxes are special light. They do not contain UVA and B. And this light intensity is 10,000 lux, which is very, very little, in fact, because when you walk outside in a sunny day, there's 100,000 lux outside around you. And this is something that we can endure, usually without looking into the sun, of course. But you get used to it. You must really adjust a bit. This is also true if you go to a sunny place in winter. Your eyes can't stand the light immediately. You need to adapt, but you can get used to it. And you can also consider to use the blue light, the glasses, for instance. That's only 6 lux. It's a very tiny little bit of light, but it's very close to the eye because it's in the glasses. And this may be better and durable for those people who are very sensitive.
Someone asked about macular degeneration, and can they still use light therapy?
I'm sorry, I didn't hear the first part.
Someone asked about macular degeneration in the eye, and can they still use light therapy?
I think this is typically a question for the GP or the eye physician that treats them. I don't think so, but I'm not sure. It depends maybe also on the severity of the degeneration, but ask your physician.
We also had questions around magnesium. Does magnesium help sleep and feelings of calmness?
Yeah, magnesium may help for restless legs. Some people benefit from magnesium citrate, not oxide, but citrate. And sometimes you need high dosages to get your muscles relaxed. But in case it doesn't work for restless legs, you need maybe gabapentin or pregabalin, and this is something your doctor can prescribe. Works very well, by the way.
Someone writes, they live in Canada and they want to know, can they start light therapy even before they notice having a few bad weeks? And can you have too much light therapy? So I'm not sure what they mean before noticing having a few bad weeks. But the question
you cannot prevent winter depression using light all the time. That's something I think I told. But you can start after 1 or 2 weeks getting lower and getting more appetite and getting more sleepy and less energy. Then you should start, and you can use it a few weeks when you think I'm up and running again. I feel good. You can stop and you can use it again if you have a relapse. It happens because winters may be long and we have to wait for the light to come.
Okay. Someone asked, can you use light therapy if your bipolar symptoms are controlled by medication?
That's a good question. We tend to be careful with people with bipolar disorder because I told already it's a real antidepressant and it can increase their susceptibility to hypomania or mania. But if your bipolar disorder is controlled, I think you need to discuss it with your psychiatrist that prescribes the medication. And maybe you could use a lower intensity of light or shorter duration, because the dosage is depending on intensity times duration and timing. So what we do is we use 10,000 lux light therapy. My presentation is ending in 5 minutes, it says.
No, we'll continue. It's just an alert.
Okay. So lower the dosage, the 10,000 lux back to maybe 2,500, or lower the duration back to 15 minutes and follow up if it works and whether or not your mood is getting too high. But I think this is really something to do with a physician together and not on your own.
Okay. Someone asked about spring depression, that they struggle even more with the increased daylight in spring and that causes insomnia. What can they do during spring and summer?
Wear sunglasses from 7 p.m. Make it dark for the brain at an earlier time. People living in Norway, where in summer it doesn't get dark at all, they get hypomania. because of a huge amount of a long duration of daylight. So those who are susceptible to these disorders may get it when there's too long duration of daylight. So if you're sensitive to depression in summer, it may have to do with temperature, it may have to do with light, as far as I know. So it may have a different background depending on your situation. So lower temperature may help to get better sleep and darkness, earlier onset of darkness that you artificially induced by using dark sunglasses might help, I hope.
I remember visiting Norway, and it was the most beautiful country in the summer, and I couldn't sleep. It was really, even with room darkening curtains, it was really a challenge.
Yeah, I can understand.
You had mentioned restless leg syndrome, and we had a few questions around that, about the connection with ADHD, and also it's very disruptive at night. Is there anything people can do to calm that and get some sleep?
Which syndrome was it?
Restless leg syndrome?
Yeah, restless legs, yeah. Restless legs is increased in ADHD. It's about 30% also, and we study sleep a lot, and we found out that many people have more than one sleep disorder. So they have late sleep, they have insomnia, and they have restless legs, or sleep apnea, or narcolepsy. So there's really something going on in the sleep domain in ADHD. So it can also be true that if you treat only the late sleep, you're not completely there, because the restless legs is still continuing. Restless legs is a disorder that comes with low hemoglobin. Not hemoglobin itself, but ferritin, so the storage of hemoglobin in the body. So pregnant women may develop restless legs because they lose blood and they get lower storage of ferritin. Certain medications can induce it. But in ADHD, we don't know why it's there, but it's there. And I treat restless legs patients with medication. And it is pregabalin or gabapentin. These are the best so far. But there are also other dopaminergic agonistic medications like pramipexole, and I forgot the other names because I tend to use the other ones. But you can find this, and your doctor can find it. And these medications are very effective, and pregabalin works in 1 week. It's really impressive. But the older type of medications like pramipexole, they tend to develop augmentation. And augmentation means that it doesn't work after a year or so. Then you develop some kind of tolerance. I don't know exactly. So that's why I choose for pregabalin and gabapentin. As far as we now know, this doesn't occur with those medications. I hope this is helpful.
Yeah. Someone asked, does seasonal affective disorder have an effect on heart health?
On health?
Heart health.
Heart health.
Yes.
Yeah. I think any depression has effect on heart health. And as sleep and mood are so interconnected, as I try to explain, from sleep we know that it's the mother of health. And I tend to say that sleep loss is the mother of psychiatry, because all psychiatric disorders are accompanied by sleep loss and sleep problems. And sleep works on the immune system. Sleep cures the immune system, helps you to combat bacteria, viruses, COVID, Lyme, whatever diseases, allergies. So the immune system is so very important for our health. And this is all being restored and cleaned during nighttime when we sleep. And if we sleep very little, we impact our immune system in a way that's really negative for our health. And I think this is also true for depression, because there is no mood disorder without sleep problems, whether it's bipolar, whether it's typical depression or seasonal affective disorder. In all cases, sleep is disturbed. So I think the way health is impacted is through the immune system and sleep loss.
Well, unfortunately, we're out of time, and that has to be our last question. But Dr. Kooij, thank you so much for joining us today and for sharing your expertise with our ADHD community.
My pleasure. Thank you.
Thank you. And thank you to today's listeners. If you would like to access the event resources, visit attitudemag.com and search podcast number 487. The slides and recording are posted a few hours after each live webinar. If you're listening in replay mode, simply click on the episode description. We hope to see you again next week for our free webinar on emotional dysregulation in girls with ADHD. Make sure you don't miss future Attitude webinars, articles, and research updates by signing up to receive our free email newsletters at attitudemag.com/newsletters. Thank you, everyone, and thank you, Dr. Kooij. Have a great day.